Deena Morgan, Vision Australia client.
When I lost that last bit of vision, I found myself very disorientated and I'd lost some independence. I've never had a doctor bring up emotional support or other services. I would imagine you would feel abandoned after a diagnosis because you think, well, how am I going to drive my car? Or how am I going to work if I can't see? And it just seems like impossible and out of reach.
In her home, Deena cleans the bathroom.
I have congenital glaucoma, so now I'm totally blind. When someone is given a diagnosis, often they're given their treatment and that's the end of it. If your patient displays the following signs, such as declining mental health, trouble with movement, such as falling or vertigo, or they're struggling with tasks that they do on a daily basis, then it might be time to refer them to Vision Australia, and don't wait to do this.
In a study off the kitchen, Deena types on her phone.
The services that I use at Vision Australia have been quite a suite of services. I've used orientation and mobility, educating me on transportation, on how to get to places. Another service that I've used from Vision Australia is an occupational therapist. So before I had my daughter, the occupational therapist came into our home and gave us some great tips that would help us with a new baby.
In a child's bedroom, Deena arranges clothes in a set of drawers.
And even there's one-on-one peer support programs and mentorship programs as well. And now I use screen reader software.
In the laundry, Deena turns on the washing machine.
One called Jaws, so I use that 100% of the time. That requires no visual aid or anything. It's just all through audio and speech. So I navigate my computer through a keyboard rather than using a mouse. That took a lot of training. And I did the training through Vision Australia. There's so many other aspects that need to be considered, like emotional, mental health, day-to-day living. If there was a patient who was sitting at your office, I recommend that you would ask them, okay, well, how are you traveling in your day-to-day living? Is there anything that you're struggling with? And really reading those cues, whether they're verbal or non-verbal, because then the patient may open up and say, yeah, you know what, I'm struggling with chopping up my food. It used to be something so easy and now I'm really struggling. In fact, the other day I nicked my finger because I couldn't see the knife. That is a point where, as a doctor, I would say, here are the referral details to a service such as Vision Australia that could really help you with your cooking. And it would be good if the ophthalmologist offered services such as Vision Australia, and then the next time they go to their appointment, the professional could follow up, because it is a lot to process.
Screen text, we're here to support your patients. Contact Vision Australia, 1300 84 74 66. visionaustralia.org